The Sulio point is, I love this point to treat for one particular disease. Sir, what is that one particular problem? That problem to be known as a lateral epicondylitis. Lateral epicondylitis. That means is the inflammation of the epicondyle. What is epicondyle? This is the epicondyle. This is the lateral epicondyle. So this get the inflammation. This lot of bands are there because this is connecting to the radial bone and then shoulder bone. But to combine together, so this is the lateral epicondyle is very important. That band get inflammation. That's called as a tennis elbow. That's called as a tennis elbow. When you wanted to activate a strong point for the tennis elbow, I think please take out all these needles. So the one single point to treat for the tennis elbow, that point to be known as a, this particular point LI12. This point to be known as a large intestine 12 point. This large intestine 12 point will be really useful to treat for the tennis elbow. Especially patient says, when I have the pain, especially when I have the pain, when I lift the one jug of the water, one mug of the water, one glass of the water, I wanted to drink the tea or coffee, I couldn't, I'll get the pain on my this region. Remember, when the patient is complaining, I do have the pain on this region, in the tennis elbow region, then patient is radiating the pain. He have the pain on the forearm and also the wrist pain. That indicating it is related to the tennis elbow. Got the inflammation of the lateral side of the epicondylitis, which causing the pain. That time you wanted to use one particular point. I'll show you once again. This is as a LI11 point. From the LI11, I wanted to use, when you extended, remember how to locate this point. When you extended the hand, then it is nearly two chone. When you extended, then it is the two chone. When you are closed like this, then that semiflex of the elbow, then that to be known as a one chone. Because one chone get compression here. When you extend it, there is a two chone. When you get flexion, that is the one chone. How you will going to locate, it depends on that. But however, so I wanted to use as a extension, no extension as a flexion, because you can recognize LI11 precisely good when you do the flexion of the elbow. Now you remember LI11 is here. From here, one chone proximal or 1 to 1.25 chone proximal. Touch and feel. The patient feels some kind of the pain on this region. Patient feel some kind of the sensation or the tenderness on this particular region. That time the patient feel the pain, that indicating the tennis elbow soreness is there or the tenderness is there, pain is there, then you just apply the needle. Rather than using the 1 chone, better you can use the 1.5 chone, that is the 40 mm needle is better to activate to the LI12. Now this is LI11. From here, this point to be known as a LI12, but I just inserted the needle is 1.5 chone, deep inserted the needle. This will be really good to treat for the overall tennis elbow, that is the lateral epicondylitis. Now there is another location. This is the golfer's elbow. Golfer's elbow points get differ, but the tennis elbow get differs. But I'll teach you when I'll talk about this particular region. Thank you. Please be seated.